If you're an active adult who exercises and lifts weights and you've heard the word meniscus tear, you might be thinking, I might need surgery or I'm not going to be able to lift weights anymore. I'm Dr. Ryan, physical therapist, and I'm here to tell you that that's not always the case. There are many types of meniscus tears that do really well without surgery and with conservative management, and oftentimes you can fully regain your function without any pain. Today, we're going to go over 4 key components to identifying those potential meniscus issues and what you can do about it. First, we're going to go through research that shows that meniscus surgeries are not always necessarily effective. Second, we're going to go through some tests that you can do to identify if you potentially are dealing with a meniscus issue at home on your own. And third, we're going to go through some modifications to exercise that you can do so you can continue working out and exercising while dealing with this issue. And last, we're going to give you specific mobility drills to do to try and restore your range of motion in your knee if you are having a meniscus issue. Be sure to subscribe to our channel and comment below with any questions throughout the video. So what does the research show about meniscus tears and surgery? This study is specifically looking at degenerative meniscus tears and whether or not surgery is beneficial. A degenerative meniscus tear is one of the most common types, and basically just when that cushion between our knees starts to fray and wear down. And commonly is prescribed a surgery called a meniscectomy, where they go in there and partially take out that torn piece in order to clean up the joint. What this study did was take those groups of people and split them into 2. One, a completely fake sham surgery where they actually put them under anesthesia, did a scope, but didn't touch the meniscus or didn't shave off anything from it. And then a partial meniscectomy where they went and did the normal surgery. Both groups did exercises afterwards and had follow-ups a year later, and there were basically no differences in their outcomes. So what that tells us is surgery does not mean is always effective at improving pain with meniscus tears, specifically in this case, the degenerative kind, but oftentimes clinically, there are other types of tears that do really well with conservative management and just getting good physical therapy and good personalized management of that person's pain. So how do we actually know if you have a meniscus tear? I'm going to walk you through 5 different tests that we can do. When more of them are adding up that are positive, there's a higher likelihood that that could be going on. And if you suspect this as being an issue, you should definitely go to a physical therapist or find some professional that can help you through this rather than doing it on your own. Number 1 is a history of catching or locking in your joint. And I'm not just talking about clicking or popping that you feel when you're going down the stairs or you go into a deep squat. That's just a normal part of life. Catching or locking is you go to bend your knee and it gets physically stuck. So you feel like there's a big catch or a clunk, or it's getting stuck in that bent position and you have to wiggle it around to uncatch it. Number 2 is going to be history of tenderness along the joint line here. So if you pull up your pants right along the joint line where that dimple in your knee is, if you're pressing in on there around all the way to the sides and any of that is really tender and recreating specifically your knee pain, that is another point towards this. Any of these single tests by themselves aren't necessarily all that important, but once we have 4 or 5 of them, there's a higher and higher likelihood that this could be something that you're dealing with. Next is going to be fully bending your knee using your hands. So we are just going to try to bend that knee all the way towards you as best you can. If you're not able to do that because you're getting stuck or pain along that joint line area, that is also another point towards that. If you feel like you can bend it all the way, but you're not quite sure, you can also kneel down on something and try to touch your heel towards your butt. And if that's causing you pain specifically along that area and recreating any of those issues, that's also another point towards this bucket. Next, we're going to do a modified test where we are just extending your knee, laying down like this, and trying to let your knee kind of drop down against gravity and bounce like that. You can also have someone come and just gently press down on your knee if you're not able to fully straighten it or you're not able to let it bounce and do that without pain. That's another point towards that bucket. The last and 5th test that we're going to go over is actually a test that typically should be done by a healthcare provider. So we are not going to go over that right now, but there's a modified version of something that you can do on your own. That is called the Thessaly test. And what you're going to do on that side, you're going to balance on the leg that you potentially are having the issue. If you need to hold on to something, you can. And then you're going to twist and turn as far as you can in either direction while keeping that knee straight forward. You can do it with a slight 30-degree bend in the knee, and then again with a little bit more of a bend. And as you're turning, if you're getting any of that like audible clicking or pain or discomfort along that joint line area, recreating your pain, that is also a positive test. So we just went through 5 criteria. If you have 1 or 2 of those issues, you probably don't have a meniscus issue going on. If you have 4 or 5 of those issues, the likelihood goes up a significant amount. And it's pretty hard for us to say that there's not that issue going on, but you can't definitively say that it is. So if you're having those issues, what I want you to try next are going through these exercises that really help improve your ability to bend and rotate that knee and should help with some of those symptoms, in addition to continuing to modify your workouts like we've already talked about. So if based on those tests, you think you might have a meniscus issue, oftentimes these next individual tests are also painful or causing issues. We're going to go through a quick test, follow-up exercise to improve your range of motion, and then give these a try at home. Are you able to fully sit heel towards your butt and not have pain in that knee? Or are you kind of shifting away and not wanting to bend, or is there a gap back here? But take a towel and put it behind your knee here, sitting back until you feel a nice stretch in the front, back, and side of that knee, trying to keep your heel towards your butt on that side. And you're going to hold it for about 30 seconds. Do 3 or 4 rounds of this. If there was still pain after doing this towel stretch, give this next assessment a try. We're going to take both fists here in between your knees, and we're going to see how far you can rotate your shins inward while keeping your toes on the ground. What you're going to see is this left side is a little bit more limited. I don't get as much rotation, and that is going to limit how far I can bend my knee when in the bottom of a squat. If I had difficulty bending that knee during that kneeling test that we just did, or rotating my shin inward, I'm going to take thumb and hook it behind the back of my knee here and interlock my fingers, trying to not let my heel come up off the ground. So I'm really trying to rotate my shin forward and inward as far as possible. So I don't want my knee coming in like this. I'm pushing it as far forward this way while getting some torque on that shin, going in and out of this position about 15 times. What we're trying to do here is allow improved rotation of this tibia so it can bend further and not get any pinching in the back or front of the knee, and help reduce that pain. You can test your ability to kneel again afterwards, or even get into a deep squat and see if you're able to do that without having that knee pain. When you have a meniscus issue or pain in your knee, you want to be able to stay active and keep lifting. That means modifying exercises instead of pushing through pain. So we want to continue to work on your quadriceps, your hamstrings, and your thigh muscles to keep that knee nice and strong and keep load off of that meniscus. In order to do so, one of the first things that you can do is just modify squat depth, for example. So for a back squat, just modifying into a box squat, making sure that you are still loading up those legs and not shifting away from that painful side, but you're going to a box so that we're not getting into that end range of motion that is typically the painful thing for your knee. Next, we will also want to focus on single leg strength, where we are biasing those quadricep muscles and then biasing those hamstring muscles. So to start with the quadricep muscles, a great option could be a reverse lunge, but you need to make sure you're keeping your weight over that side that we are trying to work and you're not shifting into that rear leg. So doing a loaded reverse lunge can really help improve strength in that thigh. Sometimes the instability of that can cause pain for that meniscus. So hold on to something if you need to, or just make sure you're nice and stable doing this. If you're wobbling and squirming around, that could actually cause more pain in that knee, and you might want to switch to a different type of exercise. Then we can also do a hamstring biased exercise where you are on your back, elevating your foot on top of a bench or a box and scooting further away from that and doing a single leg bridge or a double leg bridge to really activate those hamstring muscles and isolate that. Those hamstrings actually attach into the meniscus, and helping strengthen them can really help stabilize things. Last, I would also recommend doing some single leg isolated knee extension and hamstring curl machine work. This really allows you to continue to develop and isolate those quadricep, those hamstring muscles, improve support and strength at the knee, so long as it's not causing pain. Typically, these are exercises that people with meniscus issues are able to do because they're not going into those end ranges of motion. They're not causing any of that pinchiness in those weight-bearing positions, and are really great options to continue exercising. Last, if you're unable to tolerate these things, if doing the single leg reverse lunges or squatting to a box, or even doing the single leg knee extension and hamstring curl machines are still causing you pain, another good alternative could be something like blood flow restriction training. This isn't something that I would recommend doing without supervision from someone that really knows what they're doing and can program it appropriately for you. But blood flow restriction training allows you to use less weight for exercises and make just as much progress as if you're using heavier weight. Watch our other videos on this so that you can learn more about it, and click on the link in the video description if you have any interest in getting help with setting up a personalized blood flow restriction training plan. But basically, this allows you to fatigue the muscle without putting as much stress on the joint or on that meniscus. And it's not necessary for everyone, but for those that are still struggling with these exercises that we've gone through, can be a really good option. So there you have it. There are multiple ways that you can go through and test to see if you have a meniscus issue, ways that you can continue training around it, and then specific drills and exercises that you can do to improve your mobility if you're having a meniscus issue and manage your pain. If you're really serious about getting back to CrossFit, weightlifting, or just being active, and you want a more step-by-step personalized plan for you, I want you to go ahead and reach out about our online knee program. The link is in the description of the video, and you can apply there for a free discovery call to see if it's potentially the right fit for you. If not, I want you to make sure you subscribe so that you see our future helpful videos that are coming out on how to manage your knee pain.